In today's first interview, I'm joined by Dianne Martin, CEO of the Registered Practical Nurses Association of Ontario, WeRPN. WeRPN has released their annual report, The State of Nursing in Ontario, a 2024 review, which highlights the ongoing challenges and pressures faced by registered practical nurses across the province. With alarming statistics and urgent calls for action, this report sheds light on the critical state of healthcare in Ontario. Dianne is here to discuss the findings and what needs to be done to support RPNs and improve patient care. Welcome back, Dianne.
Thank you for having me.
We did this last year. I'm a little afraid to ask. Is it worse, better, holding its own? Where are things right now?
So what we do every year is sort of measure the experience of nurses. What are they seeing? What are they feeling? What we're finding this year is there's a few areas that are somewhat worse, but in many other areas we're seeing sort of a leveling off. Now, when I say leveling off, not leveling off at a good level, but it's encouraging to see that it's not getting worse, but the downside of that is the current state that it's in is creating a situation where nurses go to work every day, and while they're working in the role of nursing, they're planning what they're going to do with their lives next. This has been so sustained for so long, these difficulties.
Yeah, the bar is very, very low, I can imagine, right now. So nearly half of RPNs are considering leaving the profession. That's heartbreaking, especially considering what the shortage we're dealing with. So what are the main factors driving this sentiment, and how is it impacting the healthcare system?
First of all, if I could, it is nearly half that are leaving, but one of the problems that we're having is the numbers are unclear when they are shared by the government. So, for example, the government has said that last year, at any point in time, 17,700 new nurses added to the system, which is correct, but that is not a net number. That's the number of new nurses that came in. And from that number, you have to subtract the number of nurses that left. And so it's incredibly misleading. The number of practical nurses that were added is somewhere in the vicinity of 7,000 to new graduates or people coming from other countries. But the number that left was more than that. So we, for practical nurses, are at a net minus 400 nurses. So at a time when the yes, it's incredibly misleading. RNs, somewhat better, but still, after adding about 10,000 new RNs, only just under 6,000 additional. So for practical nurses, very heavily involved in caring for the aging population, when we should be adding tens of thousands, we are 414 less than we were this time last year. So that's the first important point about how many do we have. The reason they tell us they're leaving in this survey is they told us that the pay isn't reflective of the role they carry out. I'm talking about practical nurses here. They carry out a role that is closer to an RN than a PSW, but their pay is still very close to a PSW. That's the first thing that's most important to them. And the second most important reason is the workload, as you know from last year, became so much greater, but now it's become somewhat normalized. It's quite normal to go in and work shorthanded every day. And every day is a little too often to go home feeling like you failed at the very job you want to do well at.
Well, actually, that leads me right into my next question, because mental health remains a serious concern for RPNs, with 72% reporting a decline in self-care and overall mental health. So what support systems are currently in place, and what more can be done?
So the support systems, there are some nurses who are under have in their contracts negotiated for coverage for their mental health therapy, but not every nurse has that. And once again, the reason nurses are struggling with their mental health is twofold. First of all, as I previously mentioned, the moral distress of having to go into work every day and decide which portions of the care you want to provide are the most important to provide, and you go home feeling somewhat like you have just haven't done the job you're educated to do. And the other piece is, with being so short staffed, nurses aren't able to access a predictable paid time off, use their vacation time, that sort of thing. So what we need in every profession is the downtime to regroup, and also the time at work to love your job. And those are the two reasons we're experiencing some mental health issues.
Obviously, the reliance on agency nurses has increased as well, which can cost the province significantly more. I mean, we've seen that in every report. So, how is this affecting workplace dynamics and the overall budget for healthcare?
Well, in terms of the budget, not just Ontario, I saw last week that the New Brunswick Auditor General had slammed the government for the cost of what they call travel nurses.
Mm,
Ontario, we know that there is a tremendous amount of money that should be used to pay for many nurses, being used to pay for a smaller number of nurses, because hiring them through an agency is what sort of desperate organizations are forced to do. Within the working environment, it's a very difficult situation for the nurses, because first of all, they have gratitude for nurses arriving to just give them any sort of help. But when you are overworked and you are sent a nurse who, through no fault of their own, aren't familiar with the unit, aren't familiar with the routines, the policies, the type of patients, it's an added burden to the nurses who are already working in that environment. But the nurses that come that aren't familiar with the environment and need to be assisted throughout their day, those nurses can be making as much as 2 to 3 times what the nurse assisting them is making. And after a while, um, you, I think everyone can imagine the toll that takes on people who've chosen to work directly for an employer.
yeah. The report, Diane, also suggests that introducing legislated nurse to patient ratios and harmonized nursing wages can help. So, can you explain how these measures would help address the staffing crisis?
Sure. So there's also another recommendation in there that leadership needs to not allow mm, um, nursing shortages to short staffed for a shift to be normalized. And that's what nurse to patient ratios really works to achieve. It works to create a disincentive for organizations to just let hope for the best, hope that these nurses cope for the day. And of course, when you don't have nurses, you don't have to pay them. And I don't think that's the motivation of our organizations, but I think it's worth noting that we always need to create a disincentive for not for not having those nurses there. So that's the first thing. The harmonization of wages is a very interesting issue for RPNs, especially because there are two issues here. There's the pay not necessarily reflecting the job that they do in the practical nurse's case. And the second is that a nurse, some people think that you need more skills to work in a hospital. The opposite is actually true. When you're walking into someone's home to take care of someone who can be at home but has complex wounds or whatever, that amount of knowledge is tremendous that's needed to do all the different things you're going to encounter. In long-term care, to give people quality of life, regardless of their dementia or all those other elements, that takes a tremendous amount of knowledge. And yet we don't have sort of an equalization of pay across those sectors. So it is much more appealing to work in a hospital that has a great pension plan, that has great benefits, and that has, in the cases of RPN, slightly more pay. But to me, anytime we have that situation, that would suggest that hospital patients are more important than our long-term care people, or more important than those that are trying to heal in their homes. And in order to draw all of the right people to all sectors, we have to harness those wages across sectors.
So, aside from the nurse to patient ratios and harmonized nursing wages, as you just touched on, are there any other changes that need to happen more quickly to make a significant impact on the current state of nursing in Ontario?
Yeah, I think that the government should, first and foremost, should um, dedicate themselves to eliminating the agency nursing. So it can't happen overnight, but the work towards that, finding the solutions that would eliminate those, even controlling how much you are able to pay a nurse to work in an agency, to go into an organization, all of those things could help. The other thing is we talk a lot about, and this is one area where there's some good things happening. We talk about how if you give nurses a bright future, if you give them, and PSWs, if you give them programs that are going to pay for their education, they're going to stay in the profession. And so right now, it can look really appealing to become a real estate agent,
There's a new
or if you want further education, maybe an accountant, or any of those sorts of things. But if we are paying for their education, staying within the profession is much more likely. And we currently do have some time limited funding to do that. But what we need to see is for that to continue until we reach the levels we need to reach.
So you're going to be back next year. I know you will, with the
Yep.
2025 report. And I hope that it comes back rosier than this year or last year. But in the meantime, what can the public do to support RPNs and advocate for better conditions in our healthcare system?
I think, first of all, most patients see what's going on. Although I recently was in Emerge and saw the triage nurse taking so much abuse from people. So, first of all, be kind to the nurses when you're a patient. They are absolutely doing the best they can with very little. But I think the
100%.
public can also, you know, um, you can also communicate to people what you're seeing, what you're hearing. Most importantly, though, when it comes election time, here's what I do. I print out everybody's election platforms. Then I go through it with yellow highlighter, the things I want to talk about. And then when someone arrives at my door, or I encounter someone out there, I pull out their particular platform with my yellow highlighted bits. Now, they don't love this when I do this, but I pull out their platform with the yellow highlighted bits and say, here's what's important to me as a person, and make yourself really informed in that. Make sure you know exactly what the policies are of the people you're voting for in the next election. I think that's incredibly important.
I couldn't agree with you more. I'm not going to mention who I'm not voting for, not to make this interview political. But thank you, Dianne, for joining me. I want people to be able to find this report. It is incredibly impactful. And obviously, keep up with WeRPN through the whole year. So where can they do that?
They can go to our website, www. I guess my daughter said we don't use the W's anymore. So you're so old, Mom. WeRPN.com. And if you go there, you will find our report. And please read the entire report. There's quotes from nurses about their experiences. Whether you're a nurse or not, you're going to find it very compelling.
All right, fantastic. Dianne, thank you so much for joining me. And I hope we see you in brighter, happier conditions next year for 2025's report.
Absolutely. I hope so too.